whenever we have a question, what do we do at the first step? Normally, let's say it's a little bit of research. We want to find the answer, maybe we go online. This is actually present days, but imagine traditionally what we are familiar with. So whenever we have a question, normally we try to find who knows the answer. So we try to go to a knowledgeable person or the trustable person. And this has been the traditional or so far popular way of solving problems. And solving problems in our everyday life, we have hundreds of questions, and many times we find our answer ourselves, and most of the time, or if we don't have the answer, we ask someone. But in the time of cyber social network from you, we ask the same question, but we use a mediator. We go online and we ask a question, maybe from a friend or social network and this is one stage of online social networking. But the next level is in this level we ask a question, we share information actively. But the next level is probably we will not have to share, or we will not have to say how am I feeling today. Rather, we will use a wearable sensor that will exactly say how am I feeling physically. So this is our work, and I am Nasim Mahmood. I work with PatNet patients and social patient medical professional social network. I help Diane in this project. So this is, I'm from a computer science background and social computing backgrounds, human computer interaction background. So it's slightly different, but of course I will use humanly readable language today, not computer languages. So people are increasingly becoming health conscious. Like say 10 years ago we didn't care about UV level, or maybe say 20 years ago we didn't care about the UV level in the environment, we just ran out. And today we care about the amount of sugar we take. And at the same time we are conscious, we are careful about how am I feeling physically. It's not exactly what I am feeling mentally. So people increasingly are using wearable sensors. And so that's why we can say that patients, or if some people have some kind of medical conditions, they will probably use same sort of sensors. But there is now not enough known information about this, or about how can we really take this information and analyze. And PatNet, in this project, we are creating this typing instrument. So it's a reporting of ongoing work. And so how Dan already mentioned a lot about how caregivers, how medical professionals are acting on, and in this project our interest is to how these healthcare professionals and patients behave through interaction on social media. So how they will react, or how will they ask question online, on what kind of answer they should expect, or what will really appear like this. And at the same time, how this new form of interaction can really benefit them, the patients. So in reality, we do have a lot of information. So when one person goes to a doctor, he brings along a lot of information with him. And this information is like kind of scattered, so doctor has to interrogate, ask one question after another, and also have to test his blood pressure, etc., etc. But the thing is, he had a lot of information with him, but probably some are missing, some are misunderstood, some are even out of focus, but those are important. So we want to bring it together, and we want to provide a tool to neatly analyze, neatly put this information together so that it has meaningful information. And at the same time also want to provide a know-how how to actually extract data and put together to make a meaning out of it. So in the traditional approach, or in this existing approach, people go to medical professional, let's say patient 1, and say patient N, they're going to one doctor or one group of doctors sitting in one physical location, and another group of patients are going to another doctor or another medical persons. So this is how it's working. In this traditional approach, it's not all about all bad, because people, it's working approach, working system, but it's we are saying it's traditional. We want to look forward what we can offer with online or cyber world. So all these patients in this present world, we can see that they go online before going to a doctor. Most of the cases, even just ask which doctor should I go or what should I do. So they do their little research, and some patients actually take advice and really do maybe sometimes not so medically good decision. And these medical professionals, the doctors, also have their own network, but this is a kind of formal scientific social network. So they write papers, they go to conferences, and they share information. So in these two social networks, there are a couple of problems. One, with this patient social network, it is kind of, when they go online, there is no guarantee that this information is validated or is coming from a really knowledgeable person, because it's medically sensitive information. And for the medical doctors' cases, when they go to their conferences, most of the cases they are reporting something really old, maybe 6 months old, sometimes 5 years old, because they have this all, they have to check all this information in a very taking long time. So basic problem with this traditional information or traditional online surfing for medical information is that we do have a lot of information online, but these are scattered. And there's a serious problem we call uncontrolled flow of information. So maybe you were asking one question like, I have this condition, what should I do? Maybe a good friend is replying, but you really don't know if someone is just advertising, saying, oh, I have this condition too, and I use this thing, whatever. So this is serious issue. And another issue is insecure data dissemination. Like, for example, when we are asking question online, as a patient, maybe we cannot, some patients may not understand that he or she is exposing some sensitive information, or in some, say, in a simple Facebook scenario, people can ask a question, and maybe a Facebook friend can reply, but he or she was not sensitive enough to the question. That can negatively impact social network, your network. And we don't have any data or topic control that I already mentioned. Someone can pop up and share information. And in all cases, it's really time consuming. And for medical observation, when a patient go to a doctor, the doctor only has the laboratory information and the interview information. So doctor can ask, how was your day, or what's the problem, how do you feel, etc. And then he can send the patient for a medical checkup, like the blood pressure, etc., blood sugar, etc. But in this present time, we have actually technology, especially ICT technologies, that we can actually provide a lifelong, or maybe theoretically lifelong experience that this patient is having through. So instead of asking how did you sleep last night, doctor can, if we can provide a tool that doctor can actually see that in last 1 month this is his sleeping pattern, and this is how it was interrupted, or this many time, or he was doing exercise, etc. So this is very well. And in a general purpose social network, it's a contrast that people can go online, they can go to Facebook or something, and they have their social network, they are chatting with their friends. The problem is, first of all, as a researcher or a medical personnel, you don't have control on that data. So your patient is taking advice maybe from somewhere, in a person from America, and there's a different context, different medication system, etc. And also there's a serious issue of data protection and security. So we want to make a closed network for patients and their doctors, their medical personnel. So in this approach, still we have different patients and different doctors, and we actually mentioned as observation one, but it can be one doctor or a group of doctors. So, but we want to remove all these observations into one observation. I mean, in terms now the observation becomes one central database, and all this different time is now actually one single timeline. So a doctor sitting in Dublin or a doctor sitting in somewhere else in Ireland, they can actually see all the patients with similar criteria. And to make this online platform, we are using Web 2 technologies. So now this is the network of patients, network doctor. So in this platform or the system that we are building in under PatNet, we have three basic components. One is the user who is actually asking a question or sharing information, and their online social network or network of other patients, maybe doctor and their caregiver. Now, of course, they are wearable sensors. And the basic primary goal of this study is to study all this network information, take their sensor data, collect it somewhere in a secured way, and of course try to find patterns. So it's one very simple example. So if we have a community of patients and they're talking about something, some common thing, algorithmically, it's very easy to identify what are they talking about. For example, if you are talking about cold, so it's already known, and I mean, I think Google already has started providing a service, something like that. So we want to go much deeper or more context sensitive in terms of Ireland. And the second goal is we want to speed up the whole process. So not waiting for 6 months to see what happened in the past. Just exactly we want to see what is happening right now or what is happening in this week. So what is PatNet now? So it's a specialized online social network engine and dedicated for targeted user groups, and it's secured. We want to know about the patient. We want to analyze the data. And of course, we want to provide we want to provide a means to provide a better healthcare system. So this is actually, in another way, is patient empowerment. Patient is having his own data in an object-oriented way. So this is the basic building blocks what we are dealing with. So we have sensor data, we have user interaction data with the system, we have community data. That means user is interacting with the community, within the community, or the caregivers and the doctors, etc. And all do we have in the database. So here we actually can have two different networks. One is the network of patients and their caregivers, and also the network of their sensors. So there are two layers of networks that we can exploit. And in terms of how we collect data from this online platform is that we have active input systems. That means the patient will be asked to fill in survey. So normally it could be a traditional long survey with some number of questions. And we also have progressive survey. We call it micro survey. So we ask one question a day or a week, and then based on the question, this system asks the second question and the third question. So it's like making the user a little bit engaged into the system, because we are building up, we are constructing an online social network. So it's important that we have the patient's engagement with the system. So this is way we can do it. And passive input is actually from wearable sensors. And well, there are sensors that can provide data in two ways. One is like, for example, blood pressure. So the patient can choose. He can input this data directly by manually accessing the system, or the systems that we are planning to use, like Fitbit or Withings. It has a feature that it actually takes the measurement and sends it to its own server. But we have mechanism to pull in from the server once you approve it. There are some challenges with biosensors, like there are like this very wide range of information that and wide range of what do you call the plugin system. But now we made a one generalized approach, so it's all in XML. So probably most of the, I mean, readily available sensors will work on this system. And this is how it looks. So kind of Facebook-ish pattern, because a lot of people are already familiar with Facebook, so we didn't want to introduce something new. And so we have the personal profile and picture, etc., and a pane with their sensor, like what kind of information they are having, and some detail about their, and also interaction with their other members in the network. In this sensor pane or sensor panel, the user can actually see his own statistics, and he can see a comparison within his network. So like say I ran 5 kilometers, my friends on an average run 6 kilometers, something like this. Licensing, it's a crucial issue, but I think I can skip it, right? So, but still, I mean, when a patient is registered on the system, they will have to agree with their site level licensing, and also for the medical personnel, we have a licensing to the patient, to the system, and through their institution, because the doctor can have different kind of licensing agreement. And this is an illustration of how it is done. It's not important. So where we are now, we are actually working on this system. It's in the pre-launch condition, and we are actually testing it for more usability factors. Most of the features are already in place, but still, maybe I think in a couple of weeks it will come out. And I want to show a demo. Is that okay? Yeah. Shiny, happy doctors. Okay, so this is how it looks once you are logged in, and yeah, the upside down head. And this is the person and maybe his contacts or connections, and this is the pane where you can see, like for example, weight is 180 kilogram or more, and etc., etc. And in terms of community, he or she can go to the community and see all the other persons who actually shared information in a public forum. So the guy can also share or read information, and also he gets notification once maybe a doctor can send a notification, or as a researcher we can send particular notification or survey request, etc. It's like there. And each patient can create or will have kind of capsulation around him. So this is a case. So this is one case around this patient. So we call this patient case. In this patient case, he can see all the maybe fellow mates or the fellow doctors who are actually engaging with this particular patient. And yeah, there are many other features, like the patient can write blogs and chat, etc., etc. So we are hoping to start soon. And that's the end of the demo, and thanks if you have any particular question.
why would people want to tell other people their conditions?
Yeah, that's a very nice question. Why? Thank you very much. Actually, before Facebook was there, let's see if you remember High Five, Tech In. This question was actually asked by researchers. Definitely, why would I really say that I am having? I'm having a cup of coffee, and the thing is, people do share because they do care, and there are many other issues. You already mentioned in your last yesterday's seminar that there are like 5 reasons, 6 reasons, and there are also another extra reasons. If I may amend, is territorialship. I ran 10 kilometers. So this is a state, or I am this much healthy. So still, we exactly don't know whether people will really share that I ran 10 kilometers, but since the path shows in last 15 years, the people did share. This is one, and 2 is they are gaining. It's social translucence. If I tell what I ate in last lunch, you will also tell what you ate in your last lunch. So if I say I ran 10 kilometers, and then if I share, I have an opportunity to see how I fit in this community. This is from the healthy perspective. From the medical perspective, it could be like what are other people's symptoms when I am asking for the particular question. This is one. And in terms of privacy context, I could be in a situation that I don't want to share, but I can definitely share only my information, leaving it private to any other people, at the same time gain an average of all the people in an anonymized way. So I can remain for a moment out on the other side, slightly hidden by in the door, but as you definitely agree that in online social network, the social translucence clearly applies. If I can see you, I must provide a means that you can see me. Thanks. Yes, please.
Just following up on that, I'm trying to figure out, would you expect that these kinds of networks would be bounded in terms of conditions, and would you expect that mostly it would be people who are worried about their health will sign up for a network like this? So is it going to be a network for hypochondriacs to
Thank you very much. Yeah. So I think it will be in the beginning. I mean, the plan is to bound the people around conditions, and as again, I have to refer you again. So it's a constructed social network. It's not people just came in like, oh, I want to feel good. I want to be on Facebook. So we want to tell them like, you know what, you have obesity, you are subscribed with this medical center. Basically, we are in a process of contacting a medical center, and kind of we in the process of somewhere that the persons that go to that particular medical center, it's lovely sound. Yeah. So when they go there, so we will contact them and probably offer them this as a service, so they can be online together. So this is the first phase, but I don't know how would it go, but I can see that the future would be something like, yeah, I am on this particular network. So now we are offering, please come on.
And if I'm 25 years old and I don't want my mother to see how I'm feeling and what I'm doing, can I exclude her?
Yeah, you know what? This is the exactly opposite thought that we have been thinking all the time, at least from my perspective, from a computer science perspective or human-computer interaction perspective. I was thinking that I would rather add my mother so that she is informed whenever I am incapable of communicating. This is one case. So if I am not so good at Facebooking for my particular physical condition, so rather I would add my carer, or in another way, that my carer can add my profile on top of my profile. She can add herself. So this is one condition. Definitely, if you want to hide or if you don't want to share something with a particular person, it's not only this system is not running about on a person as a capsule. So we have a privacy matrix. So on each person, we apply one whole matrix. You can actually, frankly, I mean, if you just want to hide yourself from a particular one person, it's the most simple thing. But we can also hide like, okay, I say 10 words, but the 10 status, but I want this ninth status hidden from X. It's possible.
See, this is again the problem. That is, I don't want to hide all my status. I want to see everybody else's all status.
Yeah.
So there's the good have to be somewhere
Yeah.
in the model where you would say, okay, for fair trade,
Yeah.
you have to offer certain
Yeah.
of your information in order to gain certain.
Yeah, actually, that's why I refer to the well-established human psychology or social science theory. If someone is peeping from this door, we open the door and ask, "Do you have any question?" Exactly. If someone is peeping into the system will ask, "What's wrong?
Or
do
you
you
have to allow me to peep you.
Yeah. So the system will warn him. Well, frankly speaking, we are not in that stage yet, but it's known that if you are, as I said, like if I want to have an average of the whole community in terms of running, etc., etc., I have to first share my running information. So otherwise, it's really not following the norm of social networking.
I think the recommendation system approach is quite interesting. So there is an open site, public site, very interesting, called Patients Like Me in the US. And they have this system of putting you in touch with people who are at the same stage of your condition or maybe a little bit more advanced. But you can only be able to access that if you give them enough information.
Yeah.
So it's a little bit like your trading game.
So maybe, if I may, I want to ask a general question to everyone here. Would you share, or did you share, a piece of, like, how did you feel on Facebook or any other network where you trust with your close circle? I mean, it's a general example, like not necessarily how do I feel.
I think it's a fair question. And so if you were to ask me, my first reaction would be, well, I'd rather share with my health professionals. Why should I share with others? Unless they're very close kins, my mother or brother, sister. Even then, I'm not sure I would. I'd rather share with information of professions and to rely on their knowledge of the general conditions of other people. So this is okay, for my age, you're not supposed to have so much weight. So therefore, you reduce your weight. So that I'd rather use the professionals as the brokers for the information, rather than get involved in a network situation. Well, but that's my initial response. I may change my mind.
Definitely, I agree with you. However, we can refer one work. It's I'm sorry that I cannot exactly remember the name. Or it's Canadian Health Science or Health Research. It's government organization, and they conducted a research on 23,000 people, and out of them, I think 84%. Please don't quote me, or if you are interested, I can send that paper. Okay, I'm just now trying to remember. Say 84% of the people went online about their health condition and asked question to their friends, like, I'm feeling like this, what should I do, or what is your solution? So basically, we do, at least many people do go online to ask their health related questions. I don't see any problem here at all, because normally in a let's say cyber network doesn't exist, we really go to the person we trust and say, you know what, I'm feeling like pain on my knee, and what should I do? And we actually do it even without knowing that we are sharing this information. But sometimes we become sensitive because the online the information we shared exists for indefinite time. But still people do share.
Can I expand a little bit on our research design? We envisage doing a control group, so having a group which is not online on PatNet, comparing those with the online group on PatNet to try to understand whether the level of information that's shared is different. But I made a very similar presentation to Nassim very recently in Germany, and the reaction was a little bit like yours. Why would I go to this community when I want to go to my doctor? And I said, yes, but
Yeah.
patient decides to use.
Yeah.
It reminds me very much of the current discussion in the United States about the veteran service, administration service, because to get an appointment, you have to wait sometimes 1 year, 2 years, especially dealing with the specialists. So that, well, that's the alternative, right? But I'm still concerned because my personal experience, for example, I've had this condition, so I sent to my brothers and sisters. And so one of my brothers says, "Oh, you should do this or do this," and he gave me a reference. Well, seems to be a reliable information source, but I went to that site and I find this person who wrote this information. I went to that person in the web and find the information. He was total fraud. so my brother didn't know that.
Yeah.
He didn't go deep enough, so that he provided me seemed to be a valid piece of information. But it turned out that so I go back and say, "Look, this is a fraudulent." So anyhow, just.
I think this example really backs up what we are talking about, because as I said, on an open online situation, you don't have any topic control. You don't have any, information is also scattered. And as I mentioned, like I ask a question and someone will say, blah blah blah. I took this medication and it recovered me, and he is trying to sell the product. So that's simply possible. This is one situation, and situation two, it's not two, it's a different situation, is that why people would go to online. I presented similar thing in an IPOSI, it's an Irish organization for medical personnel, patients and their rights, right? Something like that. And then I came across a person who had a disease called Parkinson. And when he was diagnosed with Parkinson, he said he was so shocked. And and not only himself, he and his family were really closed the door and about to cry, etc., something like that. And then they went online and they found information. It's so personalized, and they could not figure out. But then when they went to another doctor, they went through a counseling service, and then they found the guy is healthy for last 15, 20 years. And after that counseling, they found, okay, this is this is the condition, and you have to go with this. There is no point of being scared. And the question was, their request from them was, if he could have an online social network like this with Parkinson in the specialty, he could immediately see that there are actually 10 other Parkinson's guys, and there is nothing to be worried about at this stage or something. So at least he could save 7 days from his life, or maybe a whole life.
In China, we have some websites about doctors and patients. The doctors use their real names, but the patients, they might need to register, but they do not. They can use fake names.
Okay.
So the question is, should we be asking patients to make available their
The real name.
Yeah, actually, since it's in the development stage, we also considered this privacy, and we looked into European laws, how it is handled here. The thing is, we should actually allow patients to remain anonymous, or what do you call them, pseudonyms. So you give a funny name like Falling Snow or whatever, but if your name is maybe something Stephen. And the thing is, when you are asking a question or sharing information to the doctor, then a real name becomes really, really important. Because the doctor, we are still not sure, if a doctor is conveying a message based on a person or a patient that he met yesterday, he must, or I think, socially we must be aware that, okay, I talked to you yesterday and this is exactly me, and then if you change your name, then everything becomes invalid. So we are thinking, and in terms of computation, this is doing this slightly tricky, and so we are still thinking of how can we really achieve that. So for assigning an ID number, but real name. So you can switch. You can show only the ID number when you want to remain anonymous, and show the real name when you're asking to a doctor or your caregiver.
That will
But yeah,
Because in sharing information is very sensitive thing. The typical case is the health situation of the CEO. If one CEO got very serious illness, and the stock price will be
Sure.
yeah.
yeah, that's another case. And well, few more complicated cases could be like insurance company. If they in future ask that you have to share your wearable sensor data from last 1 year, but a good sign is, I don't know about other part of the world, but a good sign is in still Europe has proper control on this. So what kind of data can a company or industry can ask? Or it's simple. If I share an information with a doctor here, and I have a particular illness, and then if I am going to an insurance company, should I really share that doctor already told me? So the law and regulations are already in place. So that's not a complicated issue in Ireland.
So sharing the advice of the doctors will help doctors build up their reputation. So maybe you can also do another research from the same thing to have a look at.
To explore whether that's a motivating factor for them to get involved online and such.
Yeah.
And
Yeah. Thank you very much. And we also thought in the beginning, but some literature actually suggests quite controversial. Maybe a group of doctor or doctor from particular culture could decide that I am not going to say something that remains online, and you can come back and sue. So it depends also on the culture. So we have to be really careful. Thank you very much. We have to be really careful. And as I said in the beginning, this study is about the community in Ireland.